Next, from Springfield, Congressman Schock holds a press conference with several constituents who say the rising cost of health insurance due to Obamacare is causing them to lose their existing plans and making the replacement coverage too expensive. This runs about 45 minutes.
Well, good afternoon, everyone. It's great to be in Springfield, and I appreciate all of you being here. I appreciate especially my constituents who have decided to come and share their stories. Our office has been inundated since the implementation of the Affordable Care Act on October 1st. There has been much reporting about this implementation. As you know, there was a big fight over a government shutdown at the end of September. There were many of us who were doing everything we could to try and prevent individuals from being hurt by this law. And I know that many in the news media did a very good job of suggesting that this was just political jockeying. The president suggested that a year ago it was election year politics. But what we have now found out is that the facts are out. The law is hurting millions of Americans. People's health insurance that they like, that they've chosen for them and their family, they are losing. And the president's pledge to millions of Americans when he was selling the law has been proven false. That, coupled with the fact that the rollout has been nothing short of an unmitigated disaster, Congress and the president needs to take action. Let's review a few of the facts. First of all, we have spent to date $634 million, according to CMS, on the contracts so far to providers to build the website and move forward with the rollout. Of that $634 million, to build healthcare.gov, $394 million was spent. Of the $394 million was spent to build the data hub, which is the system that's supposed to collect the individual Americans' sensitive healthcare information. $292 million was spent building the actual federal exchanges where consumers are supposed to shop for the health insurance plans. And then $31 million was spent on call centers that are supposed to be up and operating, taking individuals' applications over the phone for those that can't use the website. According to CMS, so far less than 20% of the people who attempted to log on to the website were able to do so successfully. According to CMS, insurers have not been able to connect with the IT infrastructure for the exchange. According to CMS, individuals are receiving incorrect pricing information currently on the website. According to CMS, the federal exchange is currently sending multiple enrollments for the same person to different insurers. According to CMS, the federal exchange is currently misclassifying spouses as children. And I mention this because obviously there is much consideration about people who don't want the law to be successful or don't want the rollout to be successful. This is according to Central Management Services, who's charged with successfully implementing the health care law. According to CMS, according to the Associated Press, who received a CMS internal memo, CMS has said that healthcare.gov currently, quote, poses a potentially high security risk due to the lack of testing to healthcare.gov before it was rolled out. The website was granted by the federal government a temporary security certificate so it could operate. In other words, the federal government gave its own agency a temporary security certificate even though it had not gone through the appropriate testing before it went live. The high risk of security is potentially threatening the sensitive personal information of millions of Americans to outside hackers, and that is according to CMS's own memo. Now, for those who believe that these problems are simply a matter of a website or the initial rollout, let me assure you that that is not the case. The president said that once this law was rolled out, healthcare premiums would reduce on the average per plan by $2,500 a year. There is nobody in my congressional district that I have spoken with, there is nobody who has contacted our office whose premiums have dropped by $2,500 as a result of this law. And I can assure you that if there were Americans whose health insurance premiums were going down as a result of this law on the average by $2,500, the President, the White House, the administration would certainly be talking about them. Quite the contrary. Not only are premiums going down for people who currently have health insurance, but the millions of Americans that they expect to sign up for the plan, namely young people's, health insurance is skyrocketing, as a provision of this law called community rating requires their premiums to be no less than 1/3 the most expensive person's plan within the health insurance market. What does that mean? According to American Action Forum, for a healthy, non-smoking 31-year-old male, the cheapest health insurance plan on the exchange will be 260% higher than that current plan before the Affordable Care Act. Why is this relevant? Because according to the administration, to prevent, in their words, health insurance premiums from skyrocketing after the law was implemented, they need 3.3 million people to sign up by December 31st of this year. Of the 3.3 million, they need 2.3 million young and healthy enrollees to keep premiums from skyrocketing. Well, 2.3 million young people are not going to sign up by December 31st who did not have health insurance prior to the law, when the premiums have gone up 260% on the low side for those young people. And that is precisely why this is more than just simply a website. It is long-term price increases that are unsustainable for young people, but also for families and businesses to be able to comply with this law. I want to address a few things that have been brought up in the media by the administration. They have suggested that somehow the villain in this whole saga may be the insurance companies themselves, who are arbitrarily deciding to cancel their health insurance policy rather than go along with a grandfather clause that is in the Affordable Care Act. The problem is the grandfather clause requires a number of things in order for you to exercise the grandfather clause and continue to offer your employer-provided, in order for you to continue to offer the current health care insurance. Let me find that. Too many papers in front of me. It requires that your premium, your deductibles cannot go up more than 5% than the prior year. So your copays and deductibles from one insurance plan from 1 year to the other year cannot go up more than 5%. Why is that relevant? Inflation in our country went up 4% last year. So inflation went up 4%. Insurance companies are being told if you raise your copays or premiums more than 5%, you can no longer be grandfathered. And so because of caps and limitations on what they can charge, as well as the mandates for what they have to put in their plan, insurance companies are forced to basically stop selling the health insurance that the customers like and want. So where do we go from here? Well, clearly many of those of us in Congress and many of my constituents would like this law repealed so we can start over. This law is driving up private health care coverage. This law was originally enacted, as it says, the Affordable Care Act, to make health insurance more affordable, and yet millions of Americans are seeing their health insurance do exactly the opposite, and that is to go up. The law as it stands right now forces millions of Americans out of the health insurance coverage that they like. I want to read to you not only the President's own comments, but our senior senator here in Illinois, who said on the Senate floor when it was being considered, and I quote, Senator Durbin said, I quote, "Many people say to me, I like my health insurance right now. I don't want to change. I don't want to go into Medicare or Medicaid. I like what I have. Would you please leave me alone?" The answer is yes. In fact, we guarantee it. We are going to put in any legislation considered by the House and the Senate the protection of you and your employer as an individual to keep the health insurance you have if that is what you want. We are simply trying to create voluntary choices and opportunities, end quote. Those are remarks on the Senate floor by Senator Durbin. I could read you Senate comments by Mark Bagich, Patty Murray, the list goes on and on. This wasn't just a matter of the president telling this to the American people, but all of the legislators who voted for this assured their constituents and my constituents that nothing they were doing would jeopardize the health insurance coverage that they have, that they've chosen for them and their family, and that they wish to keep. 80% of Americans had health insurance that they liked. That's why the president and his colleagues continue to assure people that nothing would change. What we can't do is destroy the private health care market in an attempt to provide coverage to the 30 million people who didn't have health insurance. And of the 30 million people who didn't have health insurance, roughly half of them were people younger than me who were choosing not to buy it out of choice. And as a result of affordable health care, their premiums are only going to become more expensive, and the chances are even more or less likely that they would make the responsible decision to provide health care for themselves as individuals. Now, where do we go from here? Well, as I mentioned, we have done everything in our power to repeal the law and replace it with something that covers people with pre-existing conditions and addresses the greatest gaps in ability for people to get coverage. That clearly has failed. The Senate is in a gridlock. The president was adamant about shutting the government down because he didn't want any changes to the law, not even a individual reprieve like we were giving to businesses. That was our final offer. So my Democratic colleagues have really dug in their heels. No changes, keep the law as it is. But given the fact that the promise has been proven false, the House of Representatives this week will introduce, and I believe will pass in a bipartisan vote, H.R. 3350, Keep Your Health Care Plan Act. And this is basically making good on the president's and many of my Democratic colleagues in the House and Senate's pledge, which is if you have health insurance that you like, that you're presently buying, that your insurance company is providing, HHS mandates will not apply, and you can continue to buy that health care plan as it is presently. And I urge my Senate colleagues that when it passes on Friday to take up this bill immediately so more Americans don't see their health care coverage getting canceled and their premiums unnecessarily skyrocketing. Now, our office has been inundated since October 1st and this rollout. And our office in Peoria, Springfield, Quincy, as well as the one in Washington, D.C., has had thousands of people call my office whose policies are being canceled, who are frustrated, who are irate, very upset. And unfortunately, more people in the month of October have lost health care coverage than have gained health care coverage under the Affordable Care Act. With me today is Tony Kulavic, who is graciously hosting us here at his auto body facility, Mike Noonan, who's an accountant with Sickett LLC, Tom Hamill, who's a partner at Harrison and Held LLC, Charlie White, who's the vice president of Illini Bank, and Kirk Sanderbeck, who is a private individual here also in the marketplace. I'm going to ask first Tony Kulavic, who is our host today and the owner of Kulavic Auto Body, to come forward to share his experiences with the Affordable Care Act. Welcome, Tony.
Thank you. What we've got here at Kulavic's Auto Body is it's just an increase in premiums. It's about 150% increase for what we currently offer our employees now. If we try to take care of some of this cost to the employees, or if we just kick them off the insurance altogether, it's going to be tough. I think some of our employees will possibly be looking for other employment to try to cover some of these health costs if we don't provide it for them. And with the increases that we have now, that's coming up this next year, it's going to be tough to cover. We're right now roughly about $19,000 a year, and the cost for the next year is going to be somewhere in about $47,000. So it's roughly about 150% increase if we keep the insurance that we have now for them. And we've provided insurance for these guys. We've got a young crew here, but most of them's been here over 10 years with us. And we've provided pretty much health insurance for them and their families the entire time. It's going to be a tough decision for what we're going to do as a business to try to provide insurance for them, or even if we can afford to provide insurance for them. We're still in meetings about that, what we're going to do with it. We have our renewal's up now, and we're able to renew now and keep our premiums pretty close to what they are for this next 12 months. But after that, what we were quoted is the increase for the same coverage is that $47,000 range.
How many people do you have and how much of the freight are you paying?
We have 10 employees now. And what was the second part?
How much are you paying? Do you pay half the coverage or all the
We
coverage?
pay 85% of the coverage. They have very, very low deductibles. They have I think it's a $20 copay. It's actually pretty good insurance that they have here. Their deductibles and their out-of-pocket expense is real low. And what we've been researching, all the deductibles are gonna be high, and their out-of-pocket expenses are gonna be high. And those employees are going to have to absorb that somehow, or we haven't made a decision on how we're gonna handle it yet. But we've been working at it pretty hard, just try to cover the employees and make sure their families are taken care of.
When you say 150%, is it 150% more than they are
It's-
now? So
it's going-
150% of what it is now, or it's going up by?
It's going up about 150%. Right now, our premiums annually is about $19,000 to cover our employees and their families. And it will be, our quote that we've got back is right at $47,000.
The increase is
The
150%.
the increase is 150%,
And that's for all of them added together, right?
yes. We are covered under one group package, and that's what our health insurance premiums are going up the following year.
Is that the exact same plan, or are they adding different features?
Exact same plan, we're exploring high deductibles, just to try to keep it affordable. But it is with, pretty much the entire package that we have now is what it's increasing.
So I presume when you say that you've talked with your current insurance company to explore those options, have you been able to access at all the exchange to look at what is available for small businesses that might be not the same but similar?
We've been on there and we haven't had any luck getting through to get the exact numbers. We can get a quote, but when you try to research it any more than that, any particulars about it, we haven't had any luck doing that.
How has those results that you've gotten, kind of the initial, you said you got a quote, how does,
Really,
that
it's
look, or
just-
it's impossible to tell?
It's kind of impossible to tell right now. It's hard to compare anything because there's nothing there to compare it to. They're giving you a number, but it's really hard to compare it right now.
If you decided to drop your insurance, have you calculated what your penalty would be if you pay that? That wouldn't take effect in 2014, but in 2015 that would take effect.
We wouldn't have a penalty.
You would not? Okay.
Because we're
That's right,
considered a
because you're-
small employer.
Under 50 employees, they don't have a penalty.
Right. Would your employees qualify for subsidies in the exchange? I mean, are they under 400% of the poverty rate?
Some of them might. Okay.
Great, thank you, Tony. Appreciate
Thank
it. This is consistent with what we've been hearing from folks, and I think the other message is not only a 150% increase, but also the deductibles and so forth are higher. One of the individuals that spoke in Peoria earlier today, his deductible is going from $4,000 an employee to $8,000 an employee deductible. So it's not even apples to apples, even with the premium increases for these folks. Our next speaker is Tom Hamill from Harrison and Held Attorneys. Tom is a partner at their firm, and he's going to share his story about their healthcare experience.
Hi. Thanks,
Tom.
Aaron. Well, good afternoon. My name's Tom Hamill, and I'm going to talk about the cost of health insurance for us this year as opposed to last year. So we had a policy of insurance that we were happy with, and that policy of insurance, we got a letter in October that said, your policy is not compliant with the Affordable Care Act, and so your policy is going to be canceled. That policy, which provided very good coverage, and which we liked, and we carefully shopped to obtain that policy, the premiums on that policy were $10,900 per year. Our deductible was $4,000. If we want to keep a $4,000 deductible for our health insurance, the new price for our premium goes up from $10,900 to $19,400 per year. That's an increase of $8,500 or $708 a month. We shopped around, we found another policy. On this policy, if we want to keep our premium at about the same amount, at about $11,000 per year, then our deductible is going to go up. It's going to go up from $4,000 per year to $12,700 per year. Now that's an increase of $8,700. So under either scenario, our total exposure for health insurance this year, or our total potential cost, is up by at least $8,500. And, you know, we have one child in college this year. Next year we'll have two. This is not really a year we were looking to spend an extra $8,500 when we had, you know, done the right thing, bought our health insurance every year. One last point, the dental coverage we're now getting, if we want to be in network, we have to get rid of our dentists that we've had for the last 12 years. So that's been our story with the Affordable Care Act. We hope that the government can find something else to do, and, you know, we hope Aaron Schock and some of the others can come up with better ideas than what we have right now. Thank you.
Tom, appreciate it. Thank you. And our last speaker is going to be Kayla Edwards from Express Employment. Welcome, Kayla.
Thank you. Thank you, everyone. Again, my name's Kayla Edwards. I'm with Express Employment Professionals, and I currently have clients that are in similar situations that Kulavic Auto Body is, and your firm certainly. And unfortunately, what we are having to say to those companies is, your employees have a problem. They do have a problem. The employee mandate is kicking in January 1, and it really is the employees that are either going to spend more money, they are going to spend more money, and their deductibles are going to increase. Their out-of-pocket that they're paying every month is going to increase. And really, I just don't know many families today that are in a position to be able to pay for their prescriptions out of pocket or pay the office visit, where today, like Kulavic's, employees are used to going to an office visit if they have a cold and they pay $20, which is a great copay. And that scenario will very likely go away in 2014. So employees have a problem. We want, as employers, we want to help these employees make good decisions. Unfortunately, with the issues with the exchange, we're really just not able to understand what their offerings are and help them make good decisions about whether or not they purchase insurance on the exchange, or whether or not the employers are able to find a package that really can be affordable for the business as well as affordable for the employee and their dependents. So thank you very much.
Thank you. Appreciate it. All right, questions for any of the guests or myself?
Congressman, obviously not every insurance policy is going up like this. I have one that's not increasing that dramatically. So what's the difference here? Why are some companies doing this? Could this be opportunism on the part of some of these insurance carriers?
Is your insurance going down?
Not going down, but not going up. It's going up about what it has gone up every year for the last 15 years.
Well, you would be one of the lucky ones.
But I guess
I will
what I'm
tell
asking is,
you.
what's the difference? Why is it happening for some and not for all?
Well, I would say it's happening for more people than it's helping. The short story here is, by the administration's own estimate now, somewhere between 5 million and 15 million will lose their health care coverage that they like presently. Now, I would suggest to you that it's going to be far more than that, because some employees that work at companies like this auto body shop will not have an employer like this owner who chooses to perhaps eat a 150% increase, but rather says, our profit margin isn't good enough to be able to pay the difference. When you put additional requirements on insurance companies beyond what they currently provide, it becomes more expensive. If you go into a car lot and you choose a car with more options and more features, the car is going to be more expensive. And so I would say, to your question, some people's premiums are increasing at a higher rate than others because all insurance companies are basically being required to sell the same kind of product. And so individual choices, individual decision-making, the individual marketplace is basically being destroyed by this law. Prior to the Affordable Care Act, people got to decide how much risk do they want to take. Do they want a $500 deductible? Do they want a $2,000 deductible? Do they want dental coverage? They got to shop. Now that is being limited, and so individuals who have chosen, for example, health savings plans, for example, those are going away under the law, and in many cases, the problem is the insurance companies are being required to provide services that in many cases these plans were not providing.
What should
And
not,
so,
sorry.
and so to the point here is, how is affordable health care affordable if you can't afford it? Since when in America is it the job of the federal government to tell its citizens what health insurance they should have for themselves? Who in Washington, D.C. is smarter than the individuals behind me to decide what kind of health insurance they want for themselves? Why shouldn't these American citizens with their own taxpayer dollar be able to go out and buy whatever health insurance they want from whatever health insurance company that's available to sell whatever health insurance plan they want to sell? I mean, that's the private marketplace. And this is really social engineering at its best for the federal government to come in and tell people, I'm sorry, your health insurance isn't good enough, your plan that you've got isn't adequate, and oh, by the way, we're going to raise your premium to boot.
What would you not have these insurance plans have to cover? I know that a lot of cost, at least potentially, could come from mental health parity, for example. Should that not be a part of insurance plans? Can you speak of what would you do away with in terms of those requirements?
Well, I would say this. When the healthcare debate was occurring, the president said 80% of Americans have health insurance that they like, and we're going to make sure they can keep it. He didn't say 80% of Americans have health insurance and we're going to let them keep it so long as it's a plan that I like, so long as it's a plan that my secretary at HHS deems appropriate, so long as it covers everything that I want it to cover. So the president answered your question by saying, we're not going to touch the 80% of the market that people like and that have health care coverage and like it. So I'm not going to tell an insurance company what they have to provide. These individuals shouldn't have to tell an insurance company what they have to provide. A free and open market allows for consumers to purchase the products that fits their needs best. And so if some people want a higher deductible, if some people want a more limited plan, why shouldn't they be able to buy it? And as a matter of fact, the president made the pledge to them and millions of Americans that in fact, if they were buying it, they could continue to buy it. The plan that fit their needs, the plan that met what they needed in the healthcare space.
But there's nothing that you would take out of these plans for coverage. I mean, I know you were a state rep. Illinois requires plans include all sorts of things and continues to add on what insurers in this state have to cover.
And every state is different. And so there are plans, for example, in our state, employers here in Springfield that are self-insured, that currently do not have to meet the mandates of the state. But because of the Affordable Care Act, those self-insured plans now have to meet these new minimum standards. Those self-insured plans are either going to have to dramatically increase their costs to their employees or simply no longer provide health insurance to their employees. Home Depot two weeks ago dropped 20,000 of their employees as a part of their self-insured plan and said 20,000 employees no longer getting coverage. UPS, another self-insured plan. Union, they negotiate their health insurance. They pay for their own health insurance through their wages. They just dropped spousal coverage because under the new mandates of the self-insurance plan, it's going to be too expensive for the employer, the union member, and the employee, or the employer and the employee to pay their portions. So, I don't know how making health insurance so affordable that you can't afford, so expensive that you can't afford it, is an improvement in the marketplace.
Can you address the mental health parity aspect? Is that something that you support, and where do you stand on that?
I don't know what you're talking about.
In terms of now mental health coverage has to be covered by insurance companies the same as they cover physical ailments. That was a part of the Affordable Care Act coverage. Is that a good thing, given obviously the mental health issues that have come to light in recent years, or is that a problem?
I think individuals should be able to buy the health insurance that they want. I don't think that I should have to buy maternity coverage. I'm a single male. I'm not going to get pregnant anytime soon. I don't have a spouse. Why should I have to buy maternity coverage? Now, that's not to suggest that you don't want maternity coverage, that you don't want a health care plan that wants maternity. Well, my point here is to throw out all these red herrings as a justification for a law that is ruining the private marketplace, I think is an unfair assumption.
Aaron, what is the, so would you go again, so what's the, what are you gonna do? What can we do about it? We've laid out a lot of problems.
Well, I think we can start by making good on the president's promise, by making good on Senator Durbin's promise, by making good on Senator Murray's promise, by making good on Senator Begich's promise, which is if you like your health care coverage that you're presently buying, you can continue to buy that health care coverage. And key to that is not making the health insurance companies change their policies, basically disallowing them from providing the current coverage that you buy. And so the law that we're introducing this week, the law that the House of Representatives is scheduled to vote on Friday, is that simple change in the law, which basically allows insurance companies out from the mandates of HHS to be able to continue to provide health insurance plans that they currently were providing prior to ACA that 80% of Americans were purchasing and were happy with.
Do you have a Senate sponsor of the bill? What is the bill number? And given all the angst that has come out in the last month about this implementation, do you think the political landscape within Congress has changed so that you might actually get passage from where it was just a few weeks ago when you had the shutdown?
Great question. I do. First of all, to your first question, H.R. 3350 is the Speaker's bill that is being introduced this week, or is introduced this week, that's scheduled for a vote, H.R. 3350. Ron Johnson, who's a senator from Wisconsin, has said he's introducing a companion bill. I don't have the Senate version of it. The political landscape. Well, look, I don't think my congressional district is unique. I don't think the employers in my district are different than employers all across America. And I will tell you that my office is being inundated. People are upset, people are angry, and people are demanding action of their representatives. And you have two choices as a representative. You can either listen to the people you work for, or they will replace you. And I believe the United States Senate, even those who believe that they did the right thing in voting for this law, recognize that the Americans were sold a bill of goods, recognize the Americans were promised something that we did not deliver on, which was if they want to keep their current plan, they can keep it. So even to a Senator Durbin or a Patty Murray who fought vigorously to get this law enacted, they promised on the Senate floor that they were going to ensure there were protections for people that had health care coverage to be able to keep it as it presently was. So I don't know how they vote against a measure that fulfills and makes good their own pledge, let alone the president's own pledge. And I think that if we don't take action in the next couple of weeks, more people are going to get hurt, premiums are going to continue to rise, the 3 million people that they need on December 31st to go into the exchanges are not going to be there, and by the White House's own estimate, they're going to skyrocket. So the climate's not going to get better with inaction. And I think ultimately the Senate will be forced to act.
You're also hearing from anybody who says, this is working out great for me. I found a cheaper policy, comparable coverage, got it on the exchanges. Don't change this because this is working for me. Have you gotten anybody like that?
We have not.
Not a one.
Not a one.
Why would people who are happy contact you? I mean, we're all in public service in a way, we always hear from the complainers. Not many people say, right on, man.
Actually, I would argue with you the opposite. As someone who's been elected office for 12 years of my life, the people who call you are the people who don't agree with you. People know where I stand on this law. People know how I voted on this law. And the people who are most likely to contact me are the people who have an opposing view of me. Trust me. I know from when I vote. And so whether it be something over for perhaps the government shutdown, I can assure you the people who contacted me were upset, not the people who were saying, hey, hang in there. Now, I got people on both sides contacting me, but on this issue, I don't have anybody calling saying, oh my gosh, this has been the best thing. Thank you so much. Don't make any changes. Don't upset the exchanges. Quite the contrary. And quite frankly, Jim, I would say this. The law itself is flawed, as evidenced by the premiums and all that. But the rollout has really inhibited even the administration themselves from highlighting any successes within the system. They, by their own admission, have said more people in October are scheduled to lose coverage, more people will lose coverage than gain coverage. They had 6 people enroll in the first day. By mid-month, they had 240 people enroll. I don't know who they are, but the White House does a pretty good job of promoting itself, and I would suggest that if there are those success stories, we'll begin to hear about them. But the number of people who are being hurt far outweighs the number of people who are being helped.
How would the resolution help Tony Kulavic? He says his plan wouldn't change. It is the same plan, they just jack the rates up on it.
Well, it's not the same plan because the health insurance companies today don't have the Cadillac versions that they're being required to have. I have not found, and I'd be happy to sit down with them, I have not found somebody who has health insurance currently whose plan meets the minimum requirements of the ACA. For example, our school district, one of the top school health insurance plans in Springfield, one in Peoria, Quincy, typically school districts have good health care plans. None of them meet the minimum standard of the ACA. State Farm Insurance, big employer in my district in Bloomington. Caterpillar Insurance, big employer in my district in Peoria. Both, you talk to their employees, they think they've got great health care plans. None of them meet the minimum standards of the ACA. So it may be correct to say it's a very similar plan, but because of the new mandates and requirements is why their premiums are having to go up 150%.
Congressman, supporters of the law say that the insurance market is changing because it needs to change, that a big chunk of the people who declare bankruptcy for medical bills every year have health insurance. So they say that this shakeout period, some people are going to end up going into the exchange, some businesses will go into the shop exchange, but there's going to be a tumultuous time because a lot of the current insurance is insurance in name only, and they like it because they haven't used it. How would you respond to that? Because when people say they like their insurance, the supporters of the law say, well, they like it because they haven't gone through a severe illness with it, or they haven't really had to pay a lot out of pocket. I mean, they haven't seen a lot of benefits of their insurance. So how would you address those?
Well, first of all, I would say that sounds like a very arrogant bureaucrat in Washington, D.C. to suggest that what consumers are purchasing is not adequate.
But
to
the
suggest
reality is that a lot of them are declaring bankruptcy when they have insurance.
A lot of who?
The people who go bankrupt.
A lot of
from
the
health-
270 million Americans who had health coverage before ACA?
No, I'm the people who go bankrupt because of health care.
How about the people who are going to go bankrupt or businesses that will go out of business because of the ACA? How about auto body shops like this who may not have $40,000 in profit to be able to pay it?
What if they can get a better deal through the shop exchange?
They can't get a better deal through the shop exchange.
Well, they
You
don't
can't
know
get a
yet.
better deal on a marketplace buying a more premium automobile than the one you're driving. There's no free money. See, the news flash in all of this is the Obama administration and the White House wants you to buy more expensive health care coverage than you currently have. And the asterisk next to it is, but guess what? You might qualify for a subsidy. Well, who pays the subsidy? Anybody who's not getting a subsidy. And at the end of the day, why should we force people to buy a Mercedes-Benz or a Lexus if they're happy driving a Chevy? And to the argument that somehow the Chevy isn't adequate is completely ludicrous and a bogus argument. Now, are there some people who have misfortune through their own through no fault of their own, who go bankrupt because of healthcare difficulties? Absolutely. Absolutely. There are 300 million Americans in this country. 30 million didn't have health insurance. That means 270 million people had health insurance.
Right.
There weren't 270 million disasters. There weren't 270 million mistakes. There weren't 270 million people that needed the federal government to walk into their business, their lives, and their families and say, no, 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 no. What you're buying is not adequate. What you're buying is not going to meet your needs. What you're buying could cause you bankrupt. That's what's going on right now, and it's got to stop. These people are being hurt for no fault of their own. They're hardworking, tax-paying American citizens who don't need their federal government to walk into their daily lives and tell them what they've got isn't good enough. That's not the job of the federal government.
The flip side of that argument is that though, when people go bankrupt or they can't pay their health care costs and they have insurance, everybody pays also.
You're right. And who's going to pay for all these subsidies? Who's going to pay for the exchanges? Who paid the $600 million to design this website that doesn't work? We all did. And they're currently paying for all those people you talk about that go into the emergency room, that don't have health care coverage. It's all being consumed within the health care marketplace. You're right. There needs to be some reforms in health care, but don't destroy the health care for 270 million Americans who like their health care coverage that they've got.
When you say destroy for 270 million, a couple of analyses have said this is going to affect ultimately about 5% of consumers. We'll see some dramatic change in their policies. And most people, it's not going to change that dramatically.
No, that's not true.
Well,
5%, what you're quoting, Jim, is the 5% that the administration is saying right now. The administration is saying right now there are 5% of what they call Obamacare losers. And what the 5% is the 5% who will be denied coverage by their current insurance company. So someone like those who spoke today, whose premiums went from $500 to $1,000 or $200 to $400, they're not included in that 5% because their premiums are just going up. The 5% that the Obama administration refers to are people who are being canceled, where the insurance company are just saying, we're no longer going to take the risk based on the requirements of the ACA, we're not going to allow you coverage. But to say that only 5% are going to be negatively affected is not a true statement. 5% will be denied, will be dropped coverage by their employer, or by the insurance company.
This is kind of a dumb question. Are there any Democrats here in the group of people talking? Is everybody?
Yeah, was anybody a fan of the Affordable Care Act before you saw the details? Did anybody?
I wouldn't classify myself as either, really, to be honest with you, so. I'm just in the middle.
I
agree
think
with
I
both
was
sides in
hopeful
some-
that it would be a
some
great
areas.
thing. I'd love for people to have affordable care and affordable coverage. It's just now that the details are rolling out, it's clear this is not affordable. There might be 30 million people that have coverage, but if you look at the details that the plans are going to have, they're still going to have to spend a lot of money on health care because of the high deductibles. That's out of pocket. That is not in their budget. So it's hard to imagine that this is.
Aaron, did you hear last night, President Clinton said that President Obama should honor his commitment that you can keep your health care plan if you wish.
Well, I certainly believe there will be some senators who agree with Bill Clinton. And my hope is that there's enough senators that agree with Bill Clinton and pass the companion bill that the House will pass this week to make good on that promise.
If this resolution does pass, what's the other side of that coin? Does that affect the math as far as people who may be able to get insurance through the exchanges and what they'll be able to get? Will some of those policies no longer be offered then? Will that exclude some people who might be able, that 30 million who might have access to insurance for the first time?
Those are good questions. I don't know the answers to them. Probably the biggest problem here is that the assumptions were faulty assumptions. In other words, the assumptions of what the rates were going to be under the exchanges didn't pan out for a number of reasons. And if we make no changes to the law presently, the assumptions for the exchanges are based on 3.3 million people by December 31st. Nobody on either side of the aisle thinks you're going to have 3.3 million in the exchange. And of the 3.3 million, in order to make that assumption good, 2.3 million of them have to be young and healthy adults. Well, again, I would say humbly, there aren't going to be 2.3 million young people. So to do nothing as an excuse for messing up the assumptions with the exchange, I would simply say, well, the thing ain't going too well right now. And so to hurt people who have health insurance that they like, that want to continue to buy the plans that they're on right now, the best first step, the Hippocratic Oath in medicine, is first do no harm. And that's what this would do. Thank you.
Have you talked to Senator Kirk, and is he going to be supporting your position?
I have not talked to the senator yet, but I will be reaching out to him this week. I head back to D.C. this afternoon.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.